Well, how can I protect myself and my family members from COVID-19? Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap. Maintain at least 1 meter distance between yourself and anyone who is coughing or sneezing. Avoid touching eyes, nose and mouth. Make sure you and the people around you follow good respiratory hygiene. Stay home if you feel unwell. If you have fever, cough and difficulty in breathing, seek medical attention. This is the concluding part of the interview on COVID-19 with Bharati Maitram, State Epidemiologist on Protection from Coronavirus or COVID-19. Interviewing her is Kakching Tabam RITESH Sharma.
There's a perception that people believe, or maybe just hoping, that hot and warm weather will stop the spread of this particular virus. Is this true or it is not possible?
As of now, most of the coronavirus, that is the mild coronavirus, they tend to subside in the warmer months because they have a seasonality. But regarding this COVID-19, it is a new virus. As of now, we have not seen how it spreads in the warmer seasons.
Okay.
So it is uncertain, or rather too early to speak about whether it will tend to subside in the warmer seasons. But we have to take our precautionary steps.
Okay. How can we consider a suspect for COVID-19? Because we know that it's a festival season too. The Holi just got over, the Yaosing just got over, and there will be Jakoba and all. So how can we consider a suspect? There's a stigma associated with that as well.
Yes, we have to do away with this stigma. But to do away with this, we should know who is a suspect for COVID-19. As per the guidelines given by Ministry of Health and Family Welfare, a person who has fever, that is one major symptom, and with symptoms of respiratory illness like cough, sore throat, shortness of breath, and please mind it, there is an and a history of travel to any COVID-19 affected country within the last 14 days.
Like China, Italy, Iran.
Yes,
and,
exactly. That is a suspect. And that is the criteria number one. And the second criteria is if a person happens to be a health worker and he or she has been associated or caring for a confirmed COVID-19 patient and she has developed the symptoms in the 14 days during which he or she has cared for the COVID-19 patient, then that is also a suspect. And there is another N also.
Okay, it's getting scarier.
No, it is not getting scarier. The thing is that it is getting easier for us to know who is a suspect. And so that we can do away with stigmatizing people who have come from other countries. And the other is who has got acute respiratory illness, that is shortness of breath and all, and needs hospitalization, and for which other tests has been inconclusive. Like for swine flu, if it has tested negative, like that, for other influenza and all. So these three criteria, if we go by this, then we will know who a suspect is, and we can do away with most of the stigmatization. And at the community also, we need to know whether someone has a fever, cough, and a travel history. So we need to emphasize more on where the person has gone to.
So there are lots of if and community it's very much associated with our state too. So what actually is community spread?
Before knowing community spread, we need to know what we mean by imported, what we mean by local transmission, and this thing. Most of the cases in India earlier, it used to be from imported cases. But now there are certain cases that has occurred from the imported cases to the persons who are either his family or friends. So that is one thing, that is local transmission. But if we have to consider community spread, then it has to spread over a larger area or a larger number of people. Like it has to go from those infected from the imported cases, and I mean it has to be a secondary infection within the community. So we need to know whether that is a imported case or whether it has started circulating within the community.
That's informative. So how can one protect? Because if I'm scared, or if someone knows, and if I want to protect myself from this virus, how can I do that?
To protect myself, I need to know the certain precautionary measures that the ministry has been spreading awareness about. The first is if we have any of the symptoms of influenza, it might not be of COVID-19, then we should take the responsibility on ourselves so as not to spread to others. And we should self-isolate.
Okay.
We should not participate in certain gatherings.
Right.
That is one thing. And we should wear a mask if I have the flu.
Okay. Not to spread. Okay.
Not to spread.
Okay.
And that is one thing. In case if I have to go outside, I should wear the mask. But wearing mask is not mandatory for everybody.
Okay.
It is not necessary for a healthy person to wear a mask.
Okay.
If a healthy person wears a mask and the person who has got the symptoms doesn't wear the mask, then it is of no use.
Okay. It's happening like that.
Yeah. That is one thing. And the second is we need to do with certain respiratory hygiene like cough etiquette. Like if we have to cough, we have to cough in cloth, disposable cloth or tissue. Or if we don't have anything in hand, we should use our flexed elbow to cough in so that the virus doesn't spread to others.
Okay.
That is one thing. And the other is hand hygiene.
Okay.
We should know when to wash our hands. We should know how often we need to wash our hands.
Okay.
We should wash our hands after we have touched a thing that has been touched by someone that we don't know, whom we don't know. That is one. Washing hands does not mean that we need to use sanitizers only.
Okay.
We can wash with our usual soap and water.
Okay.
That is the best.
Okay. Not necessarily
necessarily sanitizers.
Okay. That's a good thing.
Yeah.
Because people are rushing for that. We heard that people who are older, who are above 60 years or are at the higher risk of getting infected with the virus. Is that true, or does it have an age limit on this?
As of now, it will be too early. Like there are studies going on. Those who have got lesser immune system, like the elderlies and the children.
Okay. Irrespective of age.
And those who have got comorbid conditions, as we say, like those who have got other illnesses and others who are immunocompromised, like HIV patients, then kidney transplant patients and all, they have a lower immunity. And this is a new virus. And so we have not been exposed to this virus, and so we don't know how our immune system is going to react to it.
Respond to that. Okay.
So as of now, we cannot say that a certain age group has got higher risk of contracting or in getting infected by the virus.
Okay.
But higher age groups like elderlies and the children and those who are immunocompromised and those who have got comorbid conditions like other illnesses, they are more prone to it.
And does the ministry recommend the use of sanitizers and face masks? Will it save the person to some extent? How do you respond to that?
Yes, recommendation is for hand hygiene.
Okay.
It doesn't specify that you have to use a sanitizer.
Okay.
Hand hygiene, we have to wash hands. It can be a sanitizer or a mere soap and water.
Okay.
And why we are using soap is this virus, it is an enveloped RNA virus. It has got an envelope.
Okay.
And this envelope can be destroyed by the soap particles.
Okay.
If we go into the chemical background, we have heard about amphiphilic nature of certain molecules.
Okay.
And the water loving part and the fats loving part.
Okay.
So the soap, it will react and disintegrate the envelope of the virus. And if that gets disintegrated, then it will kill the virus.
Okay.
And even if it doesn't kill, it will wash away the virus.
Okay.
And so we have to know that we have to wash our hands with soap and water. It need not be a sanitizer. And we have to wash it for about 20 seconds so that our hands have got wrinkles on it. It is not a smooth surface.
True.
And so to get off the viruses from amongst the wrinkles, so we need to wash it for about 20 seconds.
That is a deep information that you have provided, and we consider it so kind of you that you provided the information, because it also helps not to panic.
Yes.
And one concerning thing is a person who has been quarantined or who has been isolated was negative before, and afterwards, after some time or after some days, can that person be positive again?
Yes and no at the same time.
Okay.
Because quarantine is done for a person who has the risk of contracting the disease.
Right, you said
so
that.
We are going to do that for 14 or 28 days. In India, what we are doing is we are doing the quarantine for 28 days.
Okay.
That is to rule out. The incubation period is only for 14 days.
Okay.
But we are taking twice the incubation period so as to rule out any chances.
Okay.
So the thing is that the person who has been quarantined if he has tested negative, it's okay.
Okay.
But that person can again be positive, provided he has been exposed again to that virus after the quarantine period of 28 days.
Within that particular period.
Within that particular period. But because we are going to look from the date of exposure, we are going to count only 28 days. After getting out of the quarantine period, and if he gets exposed to that virus again, then he has a chance.
Okay, so we cannot relax that he has been, negative. He has to take precautionary measures too.
Yes, exactly.
Okay. One important thing is, if that too, God forbid, if the state is facing a total lockdown, let's say, what should a healthcare professional who is always going to be on duty, the police who is always going to be on duty, and the media who is going to cover the news, handle this kind of situation?
Yes, you have mentioned about a lockdown given with preventive measures that we have taken up, like the government of India, whatever they are doing. But if in case even one case, confirmed case comes up in our state, then there is a containment plan, like who should be doing what for this.
And you have already planned for that?
Yeah, the standard operating procedures are all there, and it has been disseminated to the district level.
Okay.
And the district commissioner, he will be the nodal person of everything.
Okay.
And under him, there will be health professionals, then from the home department also, and media, and they will be doing, like, even when there is a confirmed case, we have to tell the people not to panic and what is going on.
Right.
For that IEC part, a certain department has been identified by the district authorities.
Okay.
So that plan is in position, and we need not worry. And as of now, even the mask and hand sanitizers have been included in the Essential Commodities Act.
Yeah, that's true. Are our state prepared for this kind of situation? Are we ready for this?
The state is taking up whatever that needs to be done. We might not be equipped like China to build a 1,000 bedded hospital in a week.
Okay.
But then, with whatever limited resources we have, we are doing everything. All the district and the state rapid response teams are in position.
Okay.
Hospitals have been identified, beds have been identified. Then in case, if there is any case, even if the suspect is there, then we are ready to do with all the ambulance transfer and all.
Okay.
Everything is in position.
Okay.
And this has been disseminated to the districts also.
Okay.
So I would say that with the limited resources, we are equipped with our preparedness. We are prepared. But we can do with more preparation.
Okay. With people's participation.
With people's participation,
Right.
without the support of the people. If in case there is a suspect case, if in case there is a confirmed case, then I would appeal to the people not to panic, because the state is doing what needs to be done. And the people's participation, participation and support, as not to create chaos of it.
Yeah, right.
That is one thing.
And how long it will take to build the test center in Jenims?
Your information, it is already in position.
Okay.
And even RIMS has also been identified. It is waiting. Like Jenims, we have got requests from Nagaland also.
Okay.
So as to whether they can test for them. So we are equipped, and
so we don't need to send our samples to other states.
We are equipped.
Okay, that's a very good information for us. I don't want to occupy much time since you are busy running here and there. I can see that. To end this talk, so any suggestive measures in case if a catastrophe happens in the state?
Catastrophe is a very big word to use, because when we use that word, as we know its meaning, God forbid it doesn't happen. But if in case it happens, then I would suggest the people to avoid to maintain social distancing.
Okay.
That is the main thing, so as to prevent the virus from infecting us, and to do with all the respiratory hygiene and hand hygiene the government has been telling everybody about.
Okay.
So that are the minute things. These are minute things at one's level, but as we see on a whole, it will do a great lot in delaying or in what we call in stopping the spread of the disease.
Okay.
That is one thing.
Okay.
And for other measures, the state is taking up its necessary steps.
Thank you so much, Bharati, for coming to our studio, and we hope all things ends well, and hope the state government is ready to fight for this, and hope people will cooperate. There's lots of hope people will cooperate with the state health department as well. Thank you so much.
Yeah, thank you.
Hand sanitizers are the talk of the town. The role of hand sanitizers are simple. Hand sanitizers are to be used when you are caring for the patients infected with coronavirus. If hands are dirty or soiled, then use alcohol-based hand sanitizer or wash hands preferably with soap and water. All India Radio Imphal can only suggest that stay home, stay clean, stay safe and please be responsible. That was the concluding part of the interview on COVID-19 with Bharati Megdam, State Epidemiologist on protection of coronavirus or COVID-19. Interviewing her was Kalching Tabam, RITESH Sharma. Until our next episode, stay home, stay safe.